You will hear a consultant in infectious diseases, Dr. James Foster, giving a talk about the growing problem of antibiotic resistance in modern medicine. You have 90 seconds to read the questions before the recording begins. Antibiotics have been one of the most significant breakthroughs in medical history, transforming once lethal infections into manageable conditions. However, in recent decades, we've seen a dramatic rise in antibiotic resistance, a phenomenon that threatens to reverse nearly a century of medical progress. The implications of this crisis are profound, as it affects everything from routine surgeries to the treatment of life-threatening diseases. One of the primary causes of antibiotic resistance is the overuse and misuse of these medications. Despite global efforts to promote rational prescribing, antibiotics are still frequently used inappropriately. In some cases, clinicians prescribe them for viral infections where they offer no benefit, largely due to patient pressure or diagnostic uncertainty. In other cases, patients fail to complete their full course of treatment, allowing bacteria to survive and develop resistance mechanisms. The cumulative effect of these behaviors is the emergence of so-called superbugs, bacteria that no longer respond to conventional antibiotics. Methicillin-resistant Staphylococcus aureus and multidrug-resistant Klebsiella pneumoniae are two well-known examples, but the problem extends far beyond these, in particular gram-negative bacteria, which include Escherichia coli and Pseudomonas aeruginosa, are increasingly displaying resistance to even our most powerful last-line antibiotics, such as carbapenems. The rise of carbapenem-resistant Enterobacteriaceae, CRE, is especially alarming, as these infections have an extremely high mortality rate, often exceeding 50% in severe cases. The economic burden of antibiotic resistance is also substantial. Treating resistant infections is not only more difficult, but also significantly more expensive. Patients require longer hospital stays, additional diagnostic tests, and alternative medications, many of which are far more costly than standard antibiotics. Furthermore, resistant infections frequently lead to complications that require surgical intervention, adding further strain to already overburdened healthcare systems. From a clinical perspective, the lack of new antibiotics entering the market is deeply concerning. Pharmaceutical companies have largely shifted their focus away from antibiotic development, primarily because the return on investment is minimal, unlike drugs for chronic diseases, which patients take for years. Antibiotics are short-course treatments. This economic reality has resulted in near stagnation of novel antibiotic discoveries, leaving healthcare professionals with a dwindling arsenal of effective options. The drugs that are still being developed tend to be modifications of existing antibiotics rather than entirely new diseases, meaning that resistance mechanisms may evolve more rapidly. Given the scale of this problem, the medical community must adopt a multi-pronged approach. First, we need stricter antibiotic stewardship programs in both hospital and community settings. These programs should focus not only on restricting unnecessary prescriptions, but also on implementing rapid diagnostic tests that allow for more targeted therapy. The use of biomarkers, such as procalcitonin, which helps distinguish bacterial from viral infections, has shown promise in reducing unnecessary antibiotic use. However, these diagnostic tools need to be more widely accessible, particularly in low-resource settings where empirical prescribing remains the norm. Equally important is the need for global cooperation. Antibiotic resistance knows no borders, and resistant strains can spread rapidly due to international travel and trade. Many low- and middle-income countries face unique challenges, including limited access to second-line antibiotics and a high prevalence of counterfeit medications that may contain subtherapeutic doses of active ingredients, further driving resistance. Effective global surveillance networks must be strengthened, ensuring real-time data sharing between nations to track emerging resistance patterns and coordinate response efforts. Meanwhile, alternative treatment strategies are gaining attention. Phage therapy, which involves bacteriophages, viruses that infect and destroy bacteria, has shown promise in cases where conventional antibiotics fail. Some small-scale clinical trials have demonstrated success, particularly against drug-resistant Pseudomonas aeruginosa infections. However, phage therapy is highly specific to particular brain bacterial strains, meaning that widespread implementation would require individualized treatment approaches, a logical challenge in clinical practice. Another promising avenue is the development of antimicrobial peptides, which work differently from traditional antibiotics and may provide an alternative mechanism to combat resistant bacteria. Additionally, research into microbiome-based therapies suggests that restoring the body's natural bacterial balance could help prevent the overgrowth of resistant pathogens. These approaches are still in early stages, but they highlight the importance of thinking beyond conventional antibiotics. Ultimately, combating antibiotic resistance requires a shift in both medical practice and public awareness. Clinicians must embrace a more judicious approach to prescribing. Governments must enforce policies that regulate antibiotic use in both human medicine and agriculture. And the public must be educated on the dangers of misuse. Without urgent action, we risk entering a post-antibiotic era where even minor infections become life-threatening. The challenge ahead is formidable, but with coordinated global efforts, scientific innovation, and responsible antibiotic use, it is still a battle we have a chance of winning. You will have 90 seconds to complete your answers.